Alright guys, this is skill 1.24, assessing the lungs. So for this, we're going to start off with the basics of assessing the lungs. And as we continue on in your nursing student career here at Alfred, we'll add on to it. But right at this moment, we're looking for proper stethoscope placement and whether you can hear lung sounds and whether you're hearing good or bad, okay? Or what you think is good and bad, okay? So what are you going to do? What are you going to need? Well, the only equipment that you're going to need is your stethoscope, okay? Prior to going into your patient's room, you want to make sure that you clean off your stethoscope, okay? Oops, sorry. You're going to clean off the stethoscope this side and that side, okay? You want to make sure that those are cleaned off in between each patient use. So how do you do that? You use an alcohol pad, okay? So that's just a little housekeeping FYI, okay? Alright, so you gathered your equipment and your supplies, so your stethoscope, and you performed WIPSA, okay? Then you're going to inquire about the client's history of the following kind of pertinent, really kind of pertinent information concerning their lungs, okay? First one is family history. Do they have a family history of any lung conditions, lung cancer, COPD, anything like that? Have they smoked or do they smoke or have they smoked in the past? What medications are they taking? You really want to concentrate on meds that could interfere or could help with the breathing process. Okay, so any COPD meds or anything, okay? And then are they having any current problems? Do they have a cough, a wheeze, pain, any kind of swelling? Okay, so you're going to need to know all of that, okay? Then you want to visualize the chest. And so you are not going to place the stethoscope on the outside of the patient's gown, okay? You're actually going to look at the chest. So you're going to have to tell your patient, I need to expose your chest. So that's why you're going to provide the privacy and all that, okay? So what you're going to do is you're going to expose the chest. This gown doesn't unsnap on the sides. So you're just going to make sure that you can visualize the whole chest. What are you looking for right at this moment? Okay, you're inspecting. So you're inspecting for bumps, lumps, bruises, scratches, anything that is unusual for a normal looking chest, okay? All right? Then you're going to auscultate breath sounds in a symmetrical pattern. First, we're going to start off with listening to the chest wall itself. I mean, to the front of the chest, okay? And we're going to listen 10 times, 5 on each side, on the front, okay? And then we're going to go to the back. When we go to the back, I'm going to pause the camera and position the camera correctly so you can see what I'm doing in the back, okay? So, to auscultate, or to listen to the front of the chest or the front of the lungs, you want to start at the top of the chest, okay? And what you want to do is you want to listen in the same location but on each side, okay? What do I mean by that? You're going to start with 1 at the top, 2, okay? Then you're going to go slide it down, 3, and then across, 4, okay? Slide it down, 5, across, 6, slide it down and out a little for 7, across for 8. Now you're going to go to the sides, 9, and over on this side, 10. Okay? Do you get that? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I started on this side. If you start on this side, that is okay. All right? 1, 2. just make sure that you listen this way going down the chest. Okay? Doesn't matter right or left, whichever side you want to start on. All right? I'm going to pause it. I'm going to show you how to auscultate or listen to the back. All right, guys. So now we're going to auscultate the back of the patient for the lung sounds. You're going to do the same thing. You're going to work in a symmetrical pattern down the back like you did on the front of the chest, okay? You're going to start at the top, work down. You're going to listen to 8 locations, 4 on each side, okay? So it's going to look like this. 1, 2, 3, 4, 5, 6, 7, 8. Okay, again. 1, 2, 3, 4, 5, 6, 7, 8. Now, when you are moving down the back, you want to make, oh, I guess I should show you. When you're moving down the back, you want to keep it in between the shoulder blades, okay? Because you're not really going to be able to hear anything over the shoulder blades. So putting your stethoscope over here is not going to do you any good. So it's going to be more along in this line, right along the spine. You're really going to be going on just on either side of the spine to listen. And as you do, you're going to move out, okay? Because the rib cage moves out, right? So it's here, 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 and then out to the side, okay? All right. So while you're listening to your patient's lungs, you're going to listen for, well, first of all, do you hear anything? Do you hear that breath going? Okay? Or are you hearing any adventitious sounds? Adventitious means not normal, okay? A normal sound is like I just did. Okay? If you have any other sound than that, then that's an adventitious sound. As we get moving through your student nursing career, you're going to learn about the adventitious sounds. For those of you that want to listen or learn about them, I'm going to post a website for you to go on, and you can actually listen to the different sounds and, test yourself on it or become accustomed to hearing those sounds, okay? So for this right now, that is, no, I'm sorry. When you're done listening to the breath sounds, you're also going to assess breathing patterns. So that means your respiratory rate, how fast are they breathing? How slow are they breathing? And the rhythm, is it fast? Is it slow? What's the number? Okay, that's what we want to know, okay? So when you're doing respiratory, you know that you do that when you're checking the pulse. You're going to count how many respirations they're doing, right? Okay. So then you just want to determine whether that's fast or slow, okay? Whether they're really struggling, or what we call labored breathing, or if it's normal breathing, okay? And then we want to put the patient back together, okay? So we want to make sure that we put the gown back on the patient. I'm going to move the camera here, peeps, okay? We're going to move put the patient's gown back in place, okay? Then we're going to lower the head of the bed if the patient would like it. Make sure that the bed is in the lowest position. We're going to make sure they have their call bell, they're comfortable, they need anything. We're going to wash our hands, and then we're going to also document everything that we just did. Okay? So that is skill 1.24, assessing the lungs.